Hey everybody, it's Dr. Osgood here with Grassroots Functional Medicine. Today I wanted to talk about a problem that affects a lot of people in our society, thyroid dysfunction. So the American Thyroid Association estimates that 12% of the US population will develop a thyroid condition in their life. 60% of these people won't even know they had one to begin with. Women are at a much higher risk, 10 times more likely than men, and 10%, an estimated 10% of women develop thyroid conditions after pregnancy. And they see this a lot in the clinic where women start to feel poorly after they deliver and it gets blamed on postpartum depression or the baby blues. But a lot of times that's the beginning of a thyroid condition. And if the thyroid is not managed appropriately, the consequences are systematic. You can feel horribly, from head to toe, and it really can affect your quality of life. So it's something to be aware of and to really identify early, in its progression. What is the thyroid? The thyroid is a butterfly-shaped gland located in the lower front portion of the neck, and it holds the primary role of manufacturing thyroid hormones. Now, these thyroid hormones are released into the blood and carried to almost every cell in the body and play a huge role with regulating temperature and metabolism, keeping the brain, the heart, the gut, the muscles, and other organs healthy and functioning, at adequate levels. So thyroid conditions can be very, very frustrating, and unfortunately, the conventional approach to thyroid is not quite where it needs to be. A lot of people who are dealing with thyroid dysfunction go to their doctor and they get told things like, it's in your head, you're just getting older, diet doesn't matter, or my personal favorite, we just need to wait until your immune system destroys your thyroid enough to where we can properly medicate you. This does not have to be the answer. If you're not feeling well, trust your gut because there's likely something going on. There is hope. You can feel better. You can lower your autoimmune antibody production, which a lot of people are told that they cannot do. I see it all the time. And many people can even reverse the thyroid disease completely, which is pretty awesome to see. A thyroid condition does not have to be a life sentence where feeling horrible is your new norm. You can get to the root and you can feel better. How do you deal with this? So there's a lot of things involved with the healing process. Every case is different, but there's some foundational elements that need to be met. You need to have clean nutrition. You need to figure out what foods are triggering inflammation and what foods are not. And incorporating foods that are clean, non-GMO, organic ideally. You need to have clean air. You need to have clean water. This is a big one. Clean air and clean water oftentimes go overlooked, but I see mold as a big problem for a lot of people. I see, metals and toxins in water that cause inflammation and immune dysfunction. And then chronic infections. You got to figure out, is there any bacterial, yeast, or is there any parasitic infections that could be altering the immune function? Removing stress is absolutely pivotal. A lot of people don't want to go there, but you have to. If you're looking to overcome an autoimmune or a thyroid disorder, you have to figure out what stressors are there, both emotional and physical, and how you remove the ones that don't need to be there, or at least limit the ones that just aren't going to go away. Dealing with stress is absolutely paramount. Why do people stay sick? Well, I think people stay sick because as a medical community, we don't ask why enough. With health issues, asking why and correcting the why is what leads to long-term resolution. Simply managing symptoms alone isn't going to fix anything. You got to figure out what's driving the process to begin with. I look at the conventional approach to thyroid dysfunction and autoimmunity like the hammer approach. If the only tool you have is a hammer, everything's going to look like a nail. So if the only tool you have is surgery or medication, then that is what's going to be used to fix the problem. But with thyroid dysfunction and with autoimmune conditions, it's a much bigger issue and it needs to be addressed from a root cause approach, looking at the big picture and fixing all of the individual triggers that are causing immune dysfunction. When we're looking at, autoimmunity or thyroid dysfunction, again, we really want to think about why is it there to begin with. And when we're looking at autoimmunity, there's three primary things involved typically. Genetic predisposition. So usually people have a family history of autoimmune conditions or they have a susceptibility to autoimmune conditions. Now, unfortunately, we can't change your genetics, but we can change how your genes are expressed, and that's by impacting the environment and these other two factors. So leaky gut, also paramount. You got to, heal the gut, to lower inflammation. There's a lot of things you need to consider and look at. What's triggering the gut to be dysfunctional? That's what you want to ask. And then triggering events. Again, this could be a stressor, this could be an infection, this could be a toxin, it could be all three. So you really want to look at the history and figure out what's driving the immune dysfunction to begin with, and that's how you reverse autoimmunity. And it's not always easy. It takes time. It's definitely more of a marathon than a sprint, but it can be done. This is a great image I show a lot of my patients just to so they can see how complex the thyroid is. It gets treated as a very simple gland, but it is far from that. Usually it's just, okay, your thyroid's low, here's your hormone, you're on your way. But what we need to do is look at all of these different factors that lead to proper thyroid production, and that is what's going to get you well. You have to, again, look at those stressors, make sure the diet's appropriate, make sure the nutrients are where they need to be. So not only do you make thyroid hormone, but you convert that hormone into the active hormones that lead to wellness and give you back your vitality. So the reality is that each person is different and each person needs to be treated in a different fashion. So to put everybody on the same approach and expect, great results is just totally unrealistic. You have to figure out how each system is working and correct problems individually. So what do we do different? What's different about Grassroots? Well, first of all, we spend a lot of time at our initial visit really going over your health history, exploring the different aspects that may have led to the condition to begin with. We also perform comprehensive testing, so more than just TSH, more than just a CBC. We're looking at nutrition, we're looking at the gut, we're looking at hormones, we're looking for chronic infections, all of these different factors that can influence immune dysfunction. And then we develop an individualized approach tailored to your specific needs. Does this work? That's a great question, and I see it work all the time. I'm going to give you an example here of Rona. Rona came to see me when she was 12 years old. Her and her mom came to Texas from California, and they were looking to get to the root cause of her Hashimoto's. So they went to their local endocrinologist and were diagnosed with Hashimoto's and found the thyroid peroxidase antibodies, or the antibodies attacking the thyroid, to be greater than 2,500, which is super high. We actually don't know how high they were. We just know it was greater than 2,500 when normal is less than 9. Normal should be 0, but sometimes a low level is there. She was placed on thyroid medication, which is Synthroid, a synthetic hormone, and sent on her way. So Rona's mom, is awesome, and she asked the doctor, hey, what can we do so my daughter can heal? What can we do to fix this so she doesn't have to be in this situation long term? And the doctor's response, which is pretty typical, is, there's really nothing you can do. What you're going to have to do is just, we're going to have to monitor her levels, and then as her thyroid dysfunction increases and her thyroid continues to be attacked, we're going to have to continue to increase the thyroid hormone for the rest of her life. Well, she didn't take that answer very well. She wanted to understand how she could fix and help her daughter. So she ended up coming to see me, and what we did is a comprehensive assessment. We did a lot of functional medicine tests, and what we found was that she actually had a gluten and a dairy intolerance or sensitivity. She had a pathogenic bacteria in her gut. She had multiple nutritional deficiencies, and I mean multiple. She had low stomach acid, which probably led to a lot of the nutritional deficiencies, and she had higher than normal levels of heavy metals, which shows that she was not detoxifying adequately. So we put her on an individualized plan, and here's where she is 2 years later. I just saw her the other day. So Rona is full of energy. Her hair is now thick and vibrant. Her IBS symptoms, the gut symptoms that were there before, are now gone, probably because of the bacteria and the food intolerances. And then her skin is no longer dry and irritated. So she's got good complexion, she's got great color, and best yet, her TPO antibodies, the ones that her doctor said would not move or would not budge, went from greater than 2,500 to 124. That was the last count. Every time we've checked them, they have been trending down. So she's not completely out of the woods yet, but she's definitely in a much better place. And we actually took her off of her Synthroid, and now she's on the lowest dose of natural desiccated thyroid that is available. So she has done extremely well, and both her and her family have worked really hard to get her here, but it is absolutely doable, and everybody can work to get these same results. So long story short, there is hope. You can reverse thyroid and autoimmune conditions. You can feel better. And a lot of times there's much more going on than what you even suspect. So if this sounds like an approach that you're interested in, I'd love to partner with you. We have clinics in West Lebanon, New Hampshire. We have clinic in Central Texas, and we also do telemedicine consults. So feel free to look at our website, grassrootsfunctionalmedicine.com, or give us a call. We'd love to try to help you get to the root of what's going on so you can feel better and have the optimal wellness you deserve. Have a great day.